This is swanky. This is lifestyle. This is culture. Welcome to the social center of everything culture. Culture Daily.
Ladies and gentlemen, so that's how we do it. 9:15 here on Culture Daily. I want to say good morning to all my friends and family doing the watching right about now. To you, Ivan, and I know you're locked on at work watching the show right about now, and also to you, Miss Mexican Oldkind. I beg your pardon.
Mexican.
Thank you very much. Yes, yes. It's fine, but just wishing all of you a blessed day as well, and thanks for tuning into 3 Music TV. Now, this morning we are talking about oral sex. Yes, we're talking about oral sex this morning. You know, also a new article popped up about 24 hours ago talking about, cancer of the throat being related to oral sex as well. So this morning we just need to delve deeper into it to get a clear understanding of this as well. So this morning we're honored to have again Dr. Chris. Welcome. It's a happy new year. Good morning, and happy new year to you, Doc.
Happy new year to everyone and our listeners.
Yes.
We are back.
I hope you don't change I hope you don't change the what do you call it? The mindset of a lot of people like us this morning, because
Is it? Are you talking about the givers or the receivers?
The us is who and who.
I hope you don't change the mindsets of
is it the givers or receivers
this morning, talking about like attendance of church. I don't know.
Jay, you try.
But before we jump into the conversation this morning, do you want a British degree at a fraction of the cost? Well, looking for a vibrant student experience in a community that will equip you with useful employability skills, taking you a step closer to the career of your dreams. Now, you can enjoy all these and more, plus at 50% on your scholarship if you offer a degree program at Lancaster University, Ghana, where you get to be taught by the finest faculty of trained to UK standards in their ultra-modern campus. More information available to you at their website or on their website is lancaster.edu.gh, or you can also email them admissions@lancaster.edu. I beg your pardon, .gh. Call them on 0209 60 70 08. It's the only British university campus here in West Africa. And I've got great news for you. If you're broke, here's a chance for you to win 1 million Ghana cedis. Even if you're not broke, you can still win 1 million Ghana cedis. How is this possible? Telecel More Money promo is ongoing. 50 winners already have bagged 30,000 Ghana cedis. Now, because they kept on purchasing data, airtime, and reloading. Now, the 1 million Ghana cedis is up for grabs, so they're looking for that winner. Just dial *500# on your Telecel network, or you can send WIN to 500, or just download the Telecel Play app to opt in for free. Okay, join the More Money promo and make more money this joyous season. T's and C's apply. It's regulated by the NLA on the Caritas Lottery platform. Telecel, connecting energies. And lastly, also reminding you that Betway's got that feature, the Bet Saver feature, where you can win even if you miss your bet on multiple losses as well. You know, when you place a bet and then one just messes up like that, and sometimes you lose all the slip, well, you can make some money back still with the Bet Saver feature on Betway. Terms and conditions apply. It's regulated by the Gaming Commission of Ghana. Bet the responsible way. Betway, get way more. Doc, should we do it or not?
Responsibly.
Well, so now let's get into the details of the question that he just asked, as well as the answer. So we've heard about oral sex. First of all, let's break it down so that people can understand exactly, because the use of the mouth, for during intimacy,
to stimulate.
Well,
a sex partner's genitals or genital region.
So it specifically speaks to causing stimulation via the genitals,
via the mouth.
So can then kissing cause cancer? No, we are saying oral sex, and I'm saying that this oral that we speak of, not the oral of the one that's trending, but I'm talking about oral with regards to the use of the mouth during intimacy.
Right.
Does it only limit to the
No, it doesn't limit to that. Just that predominantly, the HPV virus is in the genital region, which is the anus, the vagina, and the penis.
Okay, all right. So
The HPV, human papillomavirus. Sorry.
So when we say oral sex, first off, in understanding what oral sex is, it's just the use of the mouth, right?
Yes.
On these parts as mentioned.
Yeah, so you use it on the vagina, you use it on the anus, and they use it on the penis.
Okay.
So you have mouth to penis, mouth to vagina, mouth to anus.
Look, I mean, my son funny. What about those who like to? Some ladies will tell you that they like their ears being stimulated.
No, that doesn't. That if you like sticking your tongue in people's ear and all that, you can get otitis media. That's different. You can introduce certain bacteria into a person's ear, but that's a different thing
altogether.
Yeah, we are relating this to a sexually transmitted virus, which is HPV. I want to understand whether it's related or not. Is it related that if I am having oral sex, am I going to get cancer? Yes or no?
Yeah,
that's basically what the question is. So we are going to examine that.
So the terminology oral sex is specifically to these parts.
To 3 parts.
Okay. Yeah.
So we see the region. So let's not forget, you can sometimes the scrotum is involved. That's also part because so I use the term region or genital region.
Okay.
Right.
Okay.
Because somebody can say, okay, I didn't really lick the vagina or face. I licked the clitoris. Is that was part? Yes, it's part.
So the region.
Right. So it's the whole region, the area. Yes.
Okay, so so that defines what oral sex. Now let's talk about the cancerous bit of it, and how this happens, and why they say that one of the leading causes of throat cancer is as a result of this.
Yeah. So this came about subsequent years ago. There's been an increase in throat cancer, which is called oropharyngeal cancer. Now, when we talk about the throat, we are looking at the uvula, which is when you open your throat, you see like a bell hanging, that's called the uvula, and then the sides, that's your tonsils. And then now the far back, where you can see to the back of the throat, that's where usually it forms. Now, for the cancer to form there, is related that HPV, there are about 40 types of them.
Ooh.
And it's sexually transmitted.
Sounds like taxes.
Yeah, so it's 40 types of them, and there's 2 of them that are high risk, which lead to the cancer, which is HPV 16 and 18. Now, in the lifetime of every individual, whether you've kissed somebody, you've had oral sex, you had sex, any form of everybody would have contracted HPV in one form or the other. Now, the difference is most immune systems are able to fight against and get rid of it. But the HPV virus, yes, without it leading to symptoms.
All right.
Now, some people with certain, let's say, abnormalities in their DNA structure or their immune system are able to retain the virus, which then leads for its cell replication, leading to cancer.
Okay. Can we talk a bit more about this HPV and just understand exactly, I mean, it's a virus, but how does it, what signs show, what symptoms, when you start,
it's good you ask that question.
Because you said that the body fights it,
So as
general carriers of HPV, how do we know that we are actually carriers of HPV?
No, you wouldn't know unless your test is done. So I mentioned a word as being symptomless. So you could go around infecting people and you wouldn't know. But the infectivity increases when you start to see signs as rash around the penile region, the anal region, or the vaginal region. So there was a time ago we had a talk where I talked about cauliflower infection. The infection starts as a rash in the vagina, then it starts to grow and spread and becomes like cauliflower, covers the whole vagina like a rash.
Is that different from warts?
Yes, so it starts as a genital wart. It's in that family. So it starts in the form of a genital wart, which if you don't take care, people think it's a fungal infection. They apply certain creams and all that. Then it starts to spread. Now, somebody in that state like that is easily infectious to infect somebody else. Certain males also have it rash on the tip of the penis and under the neck of the penis. So it's something like 2-3 rashes. That person's infectious. Right. So if you look at these 2 groups of people, and you see, when I speak about the anus as being part of it, most people don't check their anus, so they don't know.
But
and most people have sex.
This HPV like that region?
Most people have sex in the dark with the lights off, so you won't see all these things I'm talking about.
So Doc is trying to say that turn on the lights the first time.
Yes, see what you are dealing with.
Doc is saying that the reason why we have to make sure that we have constant power in Ghana
is it a health?
That's not what he's saying. Even if the lights are off.
Phone touch. Or do you do the day?
When you send your resignation, I just want you to know that you are working till 2030.
Now you know why the guy has blue light. Ahead of the curve, you have blue light because you are no one trouble.
You know what?
Because as soon as the white light comes on, a lot of changes will come.
Yeah.
Now, so when I was
but what would let this HPV? I want to understand this very well. Because you mentioned that it thrives well in this region. What makes this region? Is it because it's a natural orifice? Because there are nose, there's eyes, there's ears. There's mouth. There's all these are other areas.
Sexually transmitted infections.
Okay, so
it's a sexually transmitted infection.
Okay.
So like
this
just like
HPV,
gonorrhea, syphilis, chlamydia.
All right,
that's
so it's internal, not external. It doesn't live around.
No. It can be around at the tip. I said
okay.
So it can easily move from one person to the other.
Okay,
that's why it's easy for it to get.
Is it because of the? Pardon me for one expression. Is it because of the how moisty the area is? Is it that it grows such?
Very good. Okay, so we're talking about a region that doesn't see light.
Then that is actually
the dark zones.
Then that means the bottom.
So we are dark moist places.
I'm just trying to find
you see why light is important.
Yes.
You see why shining a light into the darkness is important.
Yeah.
Because we all know in biology that dark moist places like to grow bacteria. Mm-hmm. That's why washrooms, bathrooms, underwear that are not dried properly, all these things, right? So when we talk about this, the reason why this thing has gotten is alarming is because if you take 18-year-olds or about 44-year-olds, right, 85% of them enjoy oral sex.
Mm-hmm. But is it bad, doc?
With at least one sexual partner. That's a good statistics. One, we cool. Now, you increase your risk of getting this throat cancer if your partners, your oral partners, your oral sex partners.
The WhatsApp group?
Yes, is more than 4 or 5. Different people. That's how you're increasing your risk. So you have to count the number of penises you've sucked, vaginas you've licked, anuses you've licked. All that has increased your risk. Because you can't really tell who your person is seeing. You can't really tell who your who is your partner sleeping with.
So definitely increases the risk. Yes.
That's why we advise that if you want to do that, some should use the condom on the penis before you actually do that.
Doc, you mentioned,
you know that all these things we are talking about are crimes.
Yeah,
we'll come to the legal bit then. Thanks for raising that point.
So we are not condoning crime.
You mentioned, I still want the manifestation of this HPV, and just to expand on it, so that in case you come across somebody who is a carrier of this HPV, it can be identified either physically or if it has to do with tests. So I'm just saying that let's expand this HPV conversation.
Right.
You mentioned genital warts, for example. Cyril mentioned genital warts as an example of an offshoot of this. Are there any other?
Some can get discharges coming from the warts. There's redness like around the penile area or vaginal area. There's itchiness.
So at a minimal level, there's no.
There's nothing.
There's nothing. Okay.
So it could be just one.
That's why you mentioned that.
Yeah, it could just be one that is causing this problem. Just one rash or one wart. That could be causing this.
So does that mean that every rash you see around the genital area
it's a suspect?
Is a sign of.
Yes, especially if you've been, for lack of a better word, promiscuous.
Active.
You've been sexually active, but sexually active. Then you should know that this something I should take serious. Not just apply any cream or herbal cream or thing that will by applying.
Is it not too late?
At that point, yeah. But with management, it's better for it to be managed.
No, what not to spread it. But what I'm saying is that you, God forbid, at the point where you see that, they sit down and breathe.
It's far gone.
Sit down and breathe.
You need the moment to catch yourself.
When you see the common rash.
Yeah, because right now there's a treatment we have, which was about, last I checked, it was about 1,000 cedis. It's a small vial that you need to apply to the rash. Now, strangely enough, because of the location of the rash, you might need somebody else to do it. Because as soon as the medication touches live skin tissue, like tissue that is healthy, it starts to damage it. So you need to
you need to get that spot specifically.
So usually we advise that use Vaseline to do the borders as a barrier around the rash to contain it, and then you get somebody to actually with stable hands
so
do this.
Or you can use a mirror.
Topical?
It's topical.
Or you can use a mirror, right?
I don't like that
wait,
because
I don't
of
get it.
You'd
For
have
what?
to have
If you're
steady
applying.
hands.
Where?
When you
Where
see
like
the
the
rash,
rash,
you
use
build
a
a
mirror.
border.
Use a mirror.
No, he's
You
saying
have
that
to get
he's saying that
someone else
because
to
of the
apply it
nature
for
of
you.
the thing, no.
You have to get someone to apply
the medications of it damage live cells.
Any other
Healthy skin.
So it needs to be on the spot
So you are
exactly.
basically
So I'm asking if you don't
dropping a
have
nuclear
anyone.
bomb.
Yes, that's a
Use a
good
mirror.
word for it. You are nuclearizing the whole thing.
No,
So
okay. You are speaking as a female because of access, or I don't
No,
get
he's
it.
talking.
necessarily.
even for males, even for
Exactly.
males.
No, sorry.
He's
please
talking
understand.
about pain.
I'm coming. Wait, relax. Lenny said you have to use a mirror, and I'm just trying to picture at
It's
what
two
moment and
things.
instance that you need to use. Because I didn't understand what you
If
said.
you don't have anybody else
Yeah,
to
but
apply
how, but
the
how do you
medication
use a
for
mirror
you.
to? That's what I didn't understand. Sorry.
So you just use the mirror as your
Guide.
so that you can see what you are
Yeah,
doing.
this is a very she specific.
If you don't,
Is it she? Yes,
exactly.
yes.
That's what I'm
How
saying.
is
That
she specific?
Exactly,
If the
because
guy-
I'm sorry
if
to
it's
say.
If it's a guy and it's
If it's
below,
a guy
yes,
and
okay, you might want to.
you
Yeah, you
see
see it
the
well.
mirror.
No, where are you talking about the anal region?
Yes, for one.
That is no.
That's
listen,
one. Vaginal
I'm
region,
sorry.
yes.
I caught wind of your conversation. No need to fret. I'm just saying that I caught wind
We
of
are
your
not fretting.
your conversation at a point
Your
saying
faces
that
look
you
fretful.
use a mirror.
Yeah.
And I was just trying to.
I'm just surprised that you're saying you are also saying
He was
it's-
in the beginning of the
she's
conversation. He didn't hear
specific.
the beginning.
I
I
just-
get that, not for Jay.
Yeah,
For
so
him, I think for whoever it is, he
Guys,
needs a mirror.
you've all digressed. Doctor said that because of the potency and the way that medicine reacts, right? You need somebody to apply it because it destroys flesh.
We got that.
Whether the
We understood that, but we've not digressed because it's the same thing he's
Yeah.
talking about.
Yes.
If you don't have somebody to
She's
do
saying
it
if
for
you have
you,
somebody,
I'm
how? So
only
mirror is an
asking.
example.
Yes.
Can you use a mirror?
sorry.
Yes,
Okay, so yes,
Okay,
yes, you
Doc,
can.
were
Doc,
saying,
So I'll
you
address that.
explain.
I'll
The
address
one-
that.
I'm the one
So
who's
yes,
confused. Let me
yes,
ask
you
the question,
can.
please.
Yes,
I'm
you can. Based on where it is, the location.
So it's
certain
not
locations,
specific.
so certain locations, the mirror is very good because it helps you identify where it is. But sometimes it might be a place where still it will be very difficult
For you to
to apply it because fluids flow. If you apply it and it goes beyond the border of which you set, you are in trouble.
Right, okay.
Right?
So you still need to get
You
somebody.
still need somebody you trust, right?
Yeah.
So, assuming that genital warts, as described, right, forms outside. It forms outside. Let's say for a woman, it forms outside.
Yeah, for both parts, everywhere it
both
forms outside. Yeah.
So let's say it's formed on. Okay, if
So let's just say it's a
so let's
dermatological
say
condition.
yes, maybe it forms.
It presents
on the,
as a dermatologist. It's a
condition.
yes,
virus.
and it forms on the, let's say, on the penis.
Right.
That's why I asked that. How do I use a mirror in applying the cream on or medicine on?
Yes, so-
like, because I'm seeing it physically in front of me. So I was just asking. So when she said that, it was piquing my interest. Like, wait, what? I didn't understand how you need a mirror unless
Do you see
it is
all
at,
of it? Every part.
Yeah, I mean, I have access to my. I mean, sorry, but I have access to my male organ. So I
No,
yeah,
but
but,
can
but,
you
but
see
there's,
every
there are
part?
certain
That's what
regions
I'm
like the
asking.
scrotal sac, you can't see
You will
everywhere.
not see everything.
So if it's on the scrotal sac, then
good. So here's the question I asked. That
Yeah.
then I think it sits with where it's supposed.
located,
Yeah, it's
yeah.
based on what you're saying. It's about where it's supposed to be.
Yeah.
Yeah. So unless it's in an obscure place, then I may have you want to use. Yes. Then it came the second point about having somebody do it for you. I think you can do your thing yourself. Or
you see your own way, your own words. You just said obscure. So if it's an obscure place, how will you do it?
obscure means out of sight.
Yeah.
But
So how will you do it?
But I'm sure these things you can feel these things, right?
No.
Or
The medicine that you're using,
Is the reading of the medicine is not?
yes, it's not
the what? Explain it. Sorry, I did.
the medication that would.
It's basically a
is-
nuclear weapon.
Yes, and so if the skin, if it gets into contact with your skin,
But how about the
With
other
healthy-
person?
with healthy skin,
How about the person applying it? Isn't
so
the person
it's
also
supposed
healthy?
to kill that rash or
I'm just
what
saying
or
that the
what not.
applicant isn't the person also at risk as equal as you are at risk.
No, the
if
person is
you're
wearing
healthy?
gloves.
Same as you, isn't it?
No,
No, it's your body.
you see,
part
it's your
as
Why
body
wouldn't
part.
you wear
It's your body
gloves?
part we are afraid of, not your hands.
Yeah, but I'm just saying that as equal as it is a risk to you, even as your healthy part, it's also a
here's
risk to the
context.
person.
So here's the context
Yes.
for everybody. The treatment he is talking about, right, destroys both the healthy skin and the skin of the wart itself. Yes.
Yes.
Yes. So if you drop it on a 1 centimeter area, right? Both healthy and whatever infected skin or there gets killed. And the thing is supposed to die for if your body and your immune system are strong enough. When your skin regenerates, it regenerates without the presentation of the what. So if you are not careful and you apply it in a region where there is no what, you are hurting yourself for no reason. That's why he's saying that for the specificity of, it's like sending a missile to Abilene, but you don't want John Lu to be affected. You have to be very targeted. And if you think as an individual applying it is going to be problematic, maybe because it's hard to reach, you can't see well, blah blah blah, the safest way is to get somebody else to do it, so that if it's this you need to touch, you touch it and get out of there.
Just make sure you're not aroused when the person is working that out.
You wouldn't, trust me. The pain.
You know, when I say these things, when you guys give me all these reactions, I laugh at that, because the thing is that if you don't drill down to the understanding of the layman to understand what you're saying, somebody might be sitting at home and thinking that and might be confused as equally. And that's why I like to ask the details and the details. Yes. Because I mean,
we commend you on that.
Yeah.
Because so are you saying that you are representing the layman?
Because yes, already the thing is that the next question I'm coming to, and why you mentioned let somebody help, is when people have problems, opening up with such is very difficult.
Right.
You understand?
Yes.
Yeah, so what you did?
So can you figure out? Can apply this?
So you obviously do it with someone you're comfortable with.
So some use their parents. Some use their parents.
Comfortable with telling that you
Your
have
partner.
Your partner. Because because we in treatment we test both.
Let's be realistic.
So when I'm saying these things, understand me.
It's easy. Isn't it easier to tell the person?
Lenny, you are just an example of a human being. You are too far. You are not more.
No, wait. This one they are not agree because there are people you can tell.
Okay.
Isn't it easier to speak to the person
I think
you are having
they don't have
sex
anybody
with?
to tell. I think they don't have anybody to tell.
Aside that, I think that I've seen a rash somewhere and then I think it's warts and I've gotten medication for it, so please help me with it because I can't reach that region.
Right.
It's easier to tell that person, or if you have a certain relationship with your parents, it's easier to
because
also
I realize that most young
whether
women
I
is their
think
mothers who
they
do
should
it.
I mean,
Oh, your sisters.
Yeah.
I think
Some people able to tell their
I think
friends.
you guys are making rash decisions.
How long have you had?
A few minutes. I've been cooking it. I was juggling when the timing was right. How's the timing?
no.
It's okay.
Right.
It was
No,
right.
Jay, because
Oh please, I'm not against it.
I know you are not. So I'm saying that this
No, take your
situation,
time, no
I've
rush.
had people to
No rush, right?
friends who tell me that I'm experiencing this, like I don't know what to do, and I'm like I also don't know what to do. So maybe I know this person, recommend them to the person, or maybe you can go here and they come back, and I even learn because they'll tell you that there's this certain medication that you need to do, or there's this medication that you need to use, so that if at any point I find myself in the same situation, I'm not now going to start the process because I've already done it with a friend, and so I would now know who to go to, what to get and what not.
Right.
Claire, for television talk, I agree with you.
Come on.
I'm just saying that for TV talk, for just for us to make sense of what they're doing.
I don't want. That's why I don't want us to make it.
But I'm just saying that. No, I'm just saying that.
Non-existent.
No. I'm just saying that there is a conversation that would have to be had with regards to be opening up to be able to speak about a sexually transmitted disease that you have.
Infections.
And that conversation is one of the reasons why things spread.
Yes.
Because we don't talk about it.
Yes.
So I'm saying that for TV talk, we can say these things because it's right. It's what has to be done. But the reason why the reason why it is spreading is because
in the real world,
maybe I'm carrying this thing. I won't tell you, but in the moment that it presents itself, like maybe interest presents itself. You do what you have to do, and then you move on.
The light is off.
The light is off. You do what you have to do, and that's the reason why we are having conversations about spreading. But if people are going to be real, would the question that I'll ask Lenny would be: Lenny, they should tell you yes, but I want to say it on the other side of Lenny to Bevelyn. She would Bevelyn tell you that it's not like I've seen a rash. You know what it is. You have gonorrhea. You are leaking. You understand?
Yeah.
Will she open up and tell her friend that her friend or her partner, I have gonorrhea? Because hold on. The question that it will raise, if the other partner doesn't have it, it raises concern. How did you get it?
Yeah. How did I get it?
So you see the conversation that
has to be had, but
maybe
you also have it, but you are not showing signs
Good.
yet.
So it can lead to a breakup.
It should. If that's what leads to the breakup.
That is the reason why people
going.
don't talk. That's what I was trying to. The
Guys,
point I was making. I was trying to make.
so wait.
No, but if you are in the wrong, then you know.
No. That's not the conversation we're having. I'm just saying that. I'm just saying.
Yes, guy.
I'm just saying that.
Yes, guy.
It is a reason why, because people don't open up. It's a reason why there's a spread. That's all. That's all the point I'm making.
Yes.
Valid.
You see, I usually don't support this guy.
This rush.
But he's right.
That's why I said valid.
Yes. We are trivializing it and making it sound too simple. We had breast cancer we have breast cancer conversation here where people who even went to do diagnosis and were told they have breast cancer
couldn't tell their
husbands. We've had HIV, we've heard of HIV people whose status was told to them and they couldn't tell their partners for years. We've had people who have carried other people's children into marriages, and with the funeral they find out. It's hard to just come and say these things. Today that we are all hypothesizing it, and God's so good, we are not using anybody as an example. We are saying, my boyfriend of 10 years, I'll tell him that I cheated and I have gonorrhea. It's easy to say.
Saying cheating.
No, you are not getting Jeffoli's. If you, assuming you and I are dating, and then you call me, Sarah, I have gonorrhea, and then I go and do the test, I don't have gonorrhea. Lenny,
where did you get it from?
Yeah. Where did you get it from? You didn't conjure it from the sky.
But what if you also didn't cheat to get it?
It's impossible.
How?
That's what I'm saying. We are not talking about HPV.
And
that is
impossible.
Okay, so that is a critical.
Can I clarify this? Let me clarify this.
HPV.
Let me clarify this.
Wait. If you know you cheated and that's how you got the gonorrhea, obviously you're not going to be telling your partner.
Exactly, Jay Foley's point.
All I'm saying
But
that
I
the
said
reason why we don't talk about it is because it's an STD,
and
right?
a stigma.
And yes, a stigma, and it is sex related. You can't get it without by just breathing it in. It will happen through sex.
I'm going to call your
So the reason why we are having
I'll clarify. Let me finish. Okay, so every sexually transmitted infections, those listening, you here, we all know there's a timeline from infection and being infectious and symptoms. Yes, there's a timeline for each and every. It's different. HPV is one of those that can stay for 5 months, 6 months without showing any sign.
Latent.
It's latent. Let's say HPV shows up after 5 months. She broke up. She has he or she had unprotected sex in January, right? They broke up somewhere in March. She's dated somebody new, right? Somewhere in July or August, she gets the signs of, or he gets the signs of infection. He's told you have HPV. The other partner test is negative. It raises that question, where do you get it from, right? So yes, in that instance, she didn't cheat. He didn't cheat, but he has a sexually transmitted infection. So that's what we do. If you remember COVID time, contact tracing. We start going back. When was the last time you had unprotected sex? You know, we keep going back. So whoever it is, we track that person down, let the person do it. And chances are, when we test that person, if he's honest or she's honest, either they've treated theirs, they found out also and treated theirs, or they're still carrying it.
That's the first layer.
That's the first layer.
The second layer is also the fact that whether you trust the person or not, it almost near immediately makes the other person unattractive.
And the trust is broken.
Yeah. It's like, it's not rocket science. Like, you have somebody and the person comes and says, hey, I have this life-changing disease that is incurable. Hey, what are we going to do about it? The first thing you think about is, I'm out of here.
Because if I'm dating Lenny and she comes to tell me that,
a lion comes and you run out before you
I'll definitely raise eyebrows. That's what I was trying to say that.
You run before you look back and think, okay, who did I leave behind?
I totally understand that. That's why I said it's valid. But also, it's not in every case that it necessarily means the person cheated. So how Dr. Chris has explained it, yeah, I understand that. It doesn't have to be cheating for the person to.
Yeah, that was just one of the examples.
Okay.
Which means then. Other scenarios. There could be.
There are so many scenarios. So argument is we always argue either abstinence or one sexual partner. You get it? We always saying this: abstinence or one sexual partner, abstinence or use like protection and other things, right? And then the test. We always advocating that people should get tested. People should know their status. When we talk about status, people think it's only HIV. Sexually transmitted disease, there are so many. And unfortunately for us, most of them cause more problems for women than men. Because for some reason, our pathway for urinating and ejaculation is one way. It's a one-way street.
Okay.
For women, it's both ways. They menstruate, they do a lot of things coming the other way, and there are infections that go out. And the distance from the opening to the point of infection is so short, and the timeline is so short. So when we do this advocacy, we always realize that it's more women who identify these things early because they see signs and then they go and test. They see this discharge, they check. Men who have a discharge, he will walk around with it because it's not causing any discomfort at the moment, right? And so this is a very big topic that we're talking about. Oral sex, no.
Okay,
say no.
So, Doc, we speak of oral sex. Now, a carrier of this HPV, which can cause cancer equally, throat.
No, let me, before you go on, let me just say this. Okay, so the question of whether can you get cancer from HPV? True or false?
That's what we are asking you.
Yeah, basically, that's what we're asking you. It's true.
Yeah.
Because amongst one of the causes, the cancer forms that HPV can cause, the one for throat cancer is part of that group. Are we in agreement? Now, the second question is, the only way you can get throat cancer is by HPV. That's the other question. False.
Okay.
You can also get throat cancer from excessive alcohol intake and smoking.
Oh.
Is that clarified?
Okay.
So imagine this. So before you began, we even have a conversation about that. Imagine somebody who takes excessive alcohol, is promiscuous, at the same time smokes. That's a risk factor. All the three risk factors for getting throat cancer. You're on that spectrum.
Doc, is it the content of alcohol that can cause the throat cancer?
Yes, because you are damaging cells on your throat.
So the content of alcohol.
Yes.
So that particular.
That's why I say excessive.
Okay, so are there particular kinds or types? I'm not mentioning brands.
I don't know, but I think the higher, the stronger it is.
So like liquor.
What's liquor?
Hard liquor.
Kiddies liquor.
Right. So when you look at this, Michael Douglas, the actor, was the first person to be outspoken about it because he got throat cancer in 2010.
As a result of a hidden state.
Yeah, he stated with an interview with The Guardian that he got it out of cunnilingus, which is oral sex or licking or whatever you want to put it, or Tafrinsky or whatever word you want to put it. Yes. So he stated that he got it out of having oral sex, and he got it from HPV, which is from oral sex, right? Now, but when the biopsy was done and tests were done, they realized that he's, apart from him doing a lot of oral sex, he also was an avid smoker and alcohol abuser. So it was not only that.
Look.
It could have been a factor, it could not have been a factor, right? But he did get it and he got treatment for it.
Doc, at 9:45, we always ask very, very important questions. Now, that's one question I'm going to ask. Doc, taking this out of intimacy is a very big. You are asking a very huge, restriction from what we define as intimacy.
Right.
Now, I carry this on to ask this question because I know people will not ask this question. But for want of a better expression, and sorry, we are on national television in the morning. On oral sex for both genders. A woman going down on a guy and a guy going down on a girl. Omitting this, now I'm asking about this HPV virus and how it thrives. See, Doc, see how they are quick to clap.
All right, so I know your question before you go. So the producer will cue a picture for us. I'm saving. I'm saving.
The very what?
All right, so this is what you're talking about. This is your numbers. I'll give you your numbers.
Oh gosh.
So these are your numbers right there. 90.9% of women like receiving oral out of 1,150.
The percent that's missing there is grandmothers and
How do you know?
grandmothers and young children.
How do you know?
What's missing?
How do you know grandmothers are not part?
It's like the gems. It kills all them. Round it off is
So, however, 79.4% of women have had at least one unenjoyable experience when receiving oral sex. Then we go on to technique being part of it, and then you go to main reason why women enjoy oral sex is due to how their partner emotional. Right now, your question was Valos.
Mr. Vilos.
Yes. So I'm asking that, let's say the person's a carrier of this HPV,
Right.
and does not engage in oral sex, but
Right.
equally engages in regular sex. I mean, in what it's supposed to be like. Then it is still carried to the another partner, isn't it?
Yes, it's possible. Yes, because of seminal fluids and fluids from the vagina. Right.
Okay.
Now, but look at this carefully. The reason why this is really high risk is simple. Most people during sexual intercourse, the penis goes into the mouth, right? Then into the vagina. Some is that reverse. It goes into the mouth, into the vagina into the mouth. There's a bit of moving bacteria and germs from one point, or viruses from one point to the other.
Right.
So the person could have dental cavities, could have gum-related bleeding and all that, carries that certain infection into the bloodstream.
Oh, this thing you're discouraging there. So what we
you get where I'm going. So apart from us looking at the genital, we should also look at the orifice. The oral health is very important in these things. Because you are transferring from one place that you do from anus to vagina to some people are doing all three. So it's a whole triangle of germs that are not supposed to be in certain positions. Because anally there are certain bacteria that are naturally there.
They should stay there.
That's their country. And then you move them from there to somebody's mouth. Oral infection, you get oral thrush. Look at the back of the person's throat. There's an image of the throat. I wanted to explain people what you should look for when you're looking at somebody's throat. So you look at the back of the throat, you see that this whitish, foamy looking structures are formed. So now I've circled those areas. What I've circled is your tonsils, or we call it tonsils. Now this hanging part where the line crosses over, that's the uvula. And then you have the soft palate at the top, the hard palate, which is the top of your gum. Now, if you look at these teeth right there, right? If somebody has a gum infection, you're easily going to transmit all these bacteria into those through the bloodstream. So when we are talking about you need to reproduce, you need to be healthy. We should also talk about people whose orally is a no. So that is an inflamed tonsil. If you look at this image, the tonsils are inflamed due to infection. The next image would show us this one a camera image of us looking at somebody with a throat cancer, oropharyngeal cancer. You see the position? It's not at the tonsil region, it's at the back, the palate. See the back of the throat. So you have uvula at the top, you have your tonsils on the left and right, and right there in that position. So it starts as a small mass over there. You see it's bleeding. So this person is bleeding, and you see areas of the is bleeding, and then gives you head or lack of a better word. Person transmits easily to you.
Oh, yeah. So, but this being in the mouth, if the person should...
Most people won't see this. This thing I've seen in the mouth, most people won't see this.
Yes. But should the person give you head? What are you going to be?
Fellatio,
canalingus, yes. We are using the street word there.
I'm just offering
the medical word.
I'm just offering them. I'm just offering the most super option.
For me, I thought you wasn't familiar with these things.
I'm just using what he used.
I know, but I was just...
So why didn't you come at doc when he said it?
I said it twice already.
You are learning.
Maybe this is the first time you heard me say it.
Please continue.
Yeah.
Should this person now give you head and transfer?
Why are you pointing at me?
I'm pointing at the TV where we saw the tumor. What would it be? Would it also be HPV, or are you also now likely to get a cancer?
No, you wouldn't get a cancer because you need the HPV to stay, and then for immune system, your DNA structure not able to handle for the cell. So any structure that is causing a tumor is replication of cells. Because every day our cells are replicating, right? Some die off, some are replaced. Now here's the system where the system is broken down. I'm replacing the cells, but they're not dying off. That's one for causing tumors and cancers. There's other cells that are from let's say you're supposed to be on the skin, your skin cell, and now you find yourself in the throat. It's in the wrong place. So it starts to form a cyst around itself and grow.
Right. So how about kissing then?
That's what I'm saying, that if somebody had just given oral sex, right, these germs are transferred to the person's mouth and then kisses you. You are going to get it.
Right. So if it's just the two of you and you're in a very loyal relationship, it's going to be going.
It's a circle. And the question is, which of you has the strength of the immune system not to fight it and get rid of it?
Okay.
Right?
Well, yeah. So I mean, then this means that in 21st century, where
just be careful, because I don't think can we say it? Can we say people should not do it? Yes, you can. Would they stop? No. It's a choice. But we are giving people the tools that this is the risk you stand, because sex itself is risky. Unprotected sex is risky.
No, keeping protected sex is risky.
Yes.
Because very soon we tell us that the rubbers that are in use, when you take it out and it goes into the air can catch something there before you go inside there. I mean that's where the world is getting to.
Because it breaks.
Anything can happen.
Because quality, we don't know, production right now is expensive, so probably do some companies will reduce the quality, and then so though you can prevent pregnancy, you can't prevent sexually transmitted diseases. Though you can prevent sexually transmitted diseases, there's chance that person will get pregnant. There's a whole thing.
So with this prevention of, we are sitting on the HPV because it's a starting point for you to get to your,
right.
the cancer. You mentioned immunity is one way. The body's immunity is one way of.
Right.
What about okay? I don't know because we don't need to say this because people will rush for medicines. I was going to talk about medication.
There's no medication. The medication, there's a vaccine for it. Whether we have it here, I don't know. I can find out, but I know in the European countries they are given to young ladies when they hit a certain, they are given to them to protect them against having it, right? But if you have the infection, we can't risk giving you the vaccine because then they're going to increase the load, right? But the treatment for this oral cancer is surgical removal and then radiation and chemotherapy, depends on the stage in which you are in. When Michael Douglas found his was in stage 4. But they gave him an 80% chance of survival. Because HPV is not, what do you call it? It's not those aggressive cancers. When found early, you can treat early. Right? And the treatment is really good. So after 2 years, he's been in remission, which is...
What's the possibility of it reoccurring?
It's low. It's lower than most cancers. It's very low. I don't know the right number. I think it's less than 15% or so of reoccurring if found and treated.
Okay. Now...
But if you keep increasing your risk, let's say you be done the treatment, you go back to alcohol, drinking and smoking, then you're going to increase your risk to maybe 90%.
Okay, and also with contracting some of these diseases, not just HPV or all of that, a lot of people, like you said, would like to just get a cream they already have, antifungal cream, and put it on it. You said that's not the right way to do. So what do they do? Is it okay to also go to the pharmacy and get over-the-counter drugs or go to the hospital?
No, get somebody to give you the answer. Because I'll use Michael Douglas as an example, because if you read a biopic of what he said in the interview, he said he was on holiday and had seen so many doctors who didn't see it. It was somebody, I think, Canada also, who said, oh, let me see your throat, puts a tongue depressor there and looks and says, oh, we need to get this, right? So you need to get that verification that this is nothing. I feel that I always say since last year we've been saying that isn't it better for somebody to tell you who is trained to identify this, tells you this we've tested is nothing, than for you to be treating it, because sometimes you might treat it at work, it looks like it's gone, then it shows up somewhere else.
Oh, that's possible.
That's possible because you see the rash today is here, you treat it, oh, it's gone, then you forget about it. There might be a point where your immune system is low, you're not taking your vitamin C, you're not exercising, you're not doing all these things that make your immune system strong, you're not eating healthy, and then it reoccurs. And that time when it comes back, it could be worse.
So if the immune system is unable to fight it, so I'm asking, like, Lenny asks about reoccurring. Let's say you fix it for a certain time and...
No, if we treat it for you at a certain point, it's not going to come back.
Okay.
Right. But that means we need to test it and test your partner.
Okay.
Because if we treat you and you keep going back to that person, reinfection or that, it's not a good thing. It's like UTI. We treat it and then you still use the same washroom and again reinfect. Whereas that the bacterial, virus or fungal that is changing. Oh. So the medication we used for you in the beginning, we can't use it anymore. We have to combine different ones. And that's when we take a sample, take it to a lab, culture it, and find out which, and test antibiotics against it. That's in UTIs. That's in fungal infections and bacterial infections, not viral infections. Because in viral infections, it's either vaccine or surgery, or your body fights it.
Okay.
So
and this is available in hospitals.
Hospitals.
Okay.
Infectious department. When you go to infectious disease departments, they do these treatments.
Okay. Doc, we've spoken about the virus thriving in these areas. Now let's go to the male organ in terms of our time is almost up, but in terms of the semen, where you have some ladies who say
spit
that
or swallow.
They swallow. Yes, I don't know what it tastes like, but they swallow. So in such cases as well, are there risk factors that the semen carry the virus as well?
Do you want to take this one?
Yeah. He's not into semen.
He's not into semen.
He's not into semen.
But he has kids. Yes, so semen carries sexually transmitted infections because it's seminal fluid, it's a bodily fluid. So like hepatitis, B and C, seminal fluids can cause it. So you think if you swallow, you won't get you can't get it. You can't get whatever infection the person's have, you will get it too.
Okay, all right. I think that answers it beautifully. The legal.
So what's your advice?
Well, for me, I don't know how human beings are going to survive with it's as though we are asking ourselves to walk through fire, but make sure it doesn't burn you. Because at the end of the day, if that's the only pathway to get to where you're gonna get to, if fire was the only way to go through to get to a certain place, and you're supposed to walk through, expect that it's going to burn you. But wear slippers, but you'll feel some small heat. Because the thing about intimacy is that, based on what we are saying, all the parts that are engaged need to be moisturized, needs to be fluid, needs to be and this HPV, as you described, thrives in such areas,
right?
So if I'm to be intimate with my partner and I can't kiss her, I have to be careful. Sorry, I have to be careful kissing her.
Not careful.
We are saying that would she disclose? I'm just saying something that would he or she disclose to the partner that this is my situation? So, and that's why I raised that conversation about. So
are you advocating for people to get tested?
No, I'm just saying. I mean,
like two people who want to do this. We want to be exclusive to each other.
Then it is
like get tested and then know that.
Yeah,
this
then
where we are.
To be
that way, when the results come out, subsequently, you can have a conversation.
Then the legalities around
if you start from a baseline,
I don't know. I don't know the legalities around relationships in Ghana, but then it will mean that if you are going to be in a relationship, I don't mean marriage. If you are going to date somebody to prevent spread, or if you're going to be intimate, then this is a part of the mandates of the country. If you are dating without anybody, a policeman can approach you and say, "Are you dating?"
What's your test? What's your test?
Then that's where we're going to get to.
ID card.
Another thing about
people will be hot too.
I will be hot.
I mean,
one thing about viruses is that the more and more they interact with different hosts, they also adapt. That's why we were chasing COVID around like it was Chaskili. And this is a medical problem where its solution lies in behavioral change, not in medicine. The lesser your
number
partners,
of partners,
and the lesser the frequency, ultimately in a few generations, things like even this will be a thing of the past.
Mm-hmm.
So the problem is not that it exists.
That was that word, herd immunity, right?
Yes,
herd immunity.
So the problem is not that is there medicine, The problem is that we have turned sex and sexual interaction into something
free for all,
so trivial.
Social events.
It's a social event.
Yes. The real,
everybody can come and go.
Apart from the small stress relief, the real job of sex is to populate.
Yeah.
And ideally, if we were zombies and you don't have any job procreating, like your genitals, their life should be your personal business.
Right.
So all these things exist because we are eliciting the wrong behaviors. And if we really want to solve things like this, it's behavioral change. Everybody should close their zip and wear their trousers.
No, it's impossible.
So then let's go.
The reality on the ground.
So he's right. Behavioral change, or
the reality on the ground is that the emotions emotions of intimacy and the force of attraction of intimacy at any point in time can surpass a person's mental.
What's with that?
Moral this thing. So it is. So that is the.
What's with that? Like when people are like that way, when people are horny, then all of a sudden they
that
don't
is the
think
reality
anymore.
On the ground. No, it is
But
the reason
also
why
you
you
should
have
have that
things
at the
like,
back
pardon
of
for
your
want of a better
mind.
expression, but you have things like rape and abuse and all these things. It's because of the drive to it. Like if somebody reaches a certain point and just
the animalistic behavior.
It's this thing.
That's something
That's
I
your
really want to
behavior.
understand.
Yeah, we have to talk about that. That animalistic behavior.
Guys.
What is it? What's the problem?
The thing you are describing, you got there before all that is happening. That is the behavioral change. Don't put yourself in that situation.
Yeah.
No. I'm saying something like, look, hold on, Cyril, hold on. There's a video of a guy standing behind a girl at one of the concerts in December.
Yes, a pervert.
It hasn't gotten to a rape conversation. At that moment,
yes.
The guy's mindset,
yes,
is if I had minyayanka. Yes. So I'm just saying that
so he's not even
activity even at that moment.
Let me address that. And I'm saying the behavioral. Listen, the corruption of our society is part of our behavioral problem. So whoever took the camera and thought that was good content, behaviorally is corrupted. The girl who knowingly or not knowingly was encouraging it or thought, it's just one of those things, oh my God, it's a camera, my trend, is also behaviorally corrupt. The guy
Then you might want to add to
The
it.
the guy who
I
thought
guess
that.
value
What did I say?
I get your value. Oh no, hold on. Our time is up. We have to go. Then Cyril. Then we're going to get to the point where in the value chain, we're going to get to the point where the value chain, the organizer of the event itself.
Look.
Anyways,
I can't talk.
No. Let's finish and let's go. We are done.
There's something called the bystander effect. Okay, some time passed. There was a lady called Kitty Genovese. She was murdered in an apartment.
Really?
Kitty Genovese. She was murdered in an apartment block, right? And there were 14 people on their balconies who witnessed it. And everybody ran inside because they assumed that my neighbor will call the police. And she died. That is an example of bystander effect. When behaviorally we see something wrong, but we assume it is the other person's responsibility
to do something about it
because we are not in immediate danger. That pervert video of that guy treating that random girl is a typical example of it, where everybody involved, up to the people who see it on their phone and double tap, are behaviorally
then we might as well initiate what happened during the COVID where the is distance.
Yes, that's why they say society has gone.
Then next year
when the car accident happens, what's the first response? People take their phone.
Then we are at a point where we'll stop organizing concerts. This is when I become president. We'll stop organizing concerts in December. Okay. Yes. Anyway, on that note, Doc, thank you very, very much. There's a lot we've learned today. In the
you
show.
said this day they make you president.
Yeah, Charlie, this country will change in 24 hours. This is a 24-hour economy.
He's redemarcating Ghana as well.
Yes.
Is doing that?
Yeah. I'm changing the north to south to west and extending us into the sea small. All of that and more. Plus, so vote for me, make a job president. On that note, my name is Jay Foley. We'll be back here same time tomorrow with the rest of the team. Thank you so much. It's Silfa, Lenny, and Cyril and Doc. Thank you so much. Great start to a great new year as well. We are getting close to a weekend. Sit back, relax, and enjoy 3 music on Culture Daily as well. We are.
Culture Daily was brought to you by Telecel.